Hi, everyone. My name is Bill Soros. I'm the Director of Harm Reduction Services at Bay State Medical Center in Springfield, Massachusetts. And this presentation is specifically for our advanced practitioners, how to complete your notice of intent for your DEA-X or Data 2000 waiver. Now, for those that don't know, recently, the federal government removed the requirement for training to obtain the DEA-X waiver. And that DEA-X waiver allows the ability to prescribe buprenorphine, sometimes known by the brand name of Suboxone, for patients who have opioid use disorder and the treatment of opioid use disorder. So really, this was a big deal, especially for advanced practitioners, because previous to this, the requirement for training was 24 hours before you could apply for this DEA-X waiver. And that training requirement has basically been removed. And so let's go through really quickly, because now the process is pretty easy to do. So first, why should you even apply for your DEA-X waiver? Well, first and foremost, it enhances your practice. What it does is it allows you the option to prescribe buprenorphine. Sometimes you'll hear it as Suboxone is one of the brand names, for the treatment of opioid use disorder. It's free, and also it's about a 5-minute online form. In fact, the form will probably take you less time than me talking. Now, understand that by obtaining your DEA-X waiver, it does not require that you do anything. It doesn't mean that all of a sudden you are an addiction medicine provider. It doesn't require that you prescribe buprenorphine. All it does is open up options for you. Really, so there is no downside to doing this. Now, the government defines advanced practitioners as the following: nurse practitioners, physician assistants, clinical nurse specialists, certified registered nurse anesthetists, and certified nurse midwives. For the most part, the folks that we see getting their DEA-X waiver are nurse practitioners and physician assistants. So some of it will be geared towards that, but anyone in this group is applicable. And if you need more information on whether you can apply or not, I've included the SAMHSA website below, as well as a QR code. So for QR codes, take your phone, take a picture of the QR code, just put it up, open your camera, and it'll actually automatically scan and direct you to the website. So you'll see these QR codes throughout the presentation. Again, just put your phone on camera mode and literally just scan as if you were taking a picture, and you'll see the website will actually pop up and it'll link you right to the website. Now, if you're going to do this and apply, you just need a few things. First, you need your state license number. Second, you need your DEA number. And third, you need the name, the DEA number, actually not the DEA-X, you just need the DEA number, and the phone number of your supervising or collaborating physician. Now, this is an important point. It is a little bit nuanced. To my knowledge, all physician assistants they're required to have a supervising physician. So you'll definitely need that information if you're a PA. For NPs, the requirement to have a supervising physician varies by state. In Massachusetts, you do not need a supervising physician, so you can ignore needing this information. But other states, it varies. Again, I've included a website below that you may find helpful if you're not sure, as well as the QR code that will link to that website. All right, so let's actually apply. So the first thing is you need to get to the website. So I've included the URL. You can scan the QR code, or if none of that works, you can just Google SAMHSA data waiver and click on the result that has the same title. Whatever you do, you should end up here. This is the start page for applying for your DEA-X waiver. Up top, it gives some instructions, and these instructions are there for the new requirements that you don't need any training. Now, of note for our advanced practitioners, what you're going to do is slightly different. Unfortunately, these instructions were made for the physician application and not for the advanced practitioner application. So that's why we're going to go through this. But anyway, you're going to get into the system. First thing, just answer, do you work for the military, VA, Indian Health Service, or are a federal employee? For many, that will be no. Click next. Next, they're going to ask you to check your eligibility to get the waiver. And for that, you need to select your practitioner type, where you practice, and then that's where you need your state license and your DEA number. Click submit. And it will bring you to this page. Some of this should autofill. You're going to be looking at applying for a new waiver at what's called the level 30. So the level 30 means that when you get your DEA-X, you can have 30 patients that you're treating with buprenorphine on your census. Now, what does that mean on your census? That means active buprenorphine prescriptions. You can have active buprenorphine prescriptions for up to 30 patients at a time. So if you are in the emergency department, if you are a hospitalist, if you're writing a bridge prescription, you're going to write a one-time or a couple of time prescription, and then they're going to drop off your census. That person only counts on your census when that prescription is active. So that's an important point. Over years, you can treat more than 30 people. It's just you can only have 30 active people at a time at this introductory DEA-X waiver level. For all of us, likely you're not starting at the 100 patient level. That's a little bit different and you still need training. So just select no to this question here. And then obviously fill out the information and hit submit. Now you're on the page. This is the main application page. And it's all one page. You're just going to scroll down, but we're just going to quickly go through it. The first page is pretty obvious. It's just your information. And in fact, your license number and your DEA should be automatically plugged in. With regards to the address and other information, please put in your work address as well as your work telephone number and work email. The reason for this is down below, you'll be given the option to be listed as a buprenorphine prescriber on the SAMHSA website. And if you do click that option, you want your address to be listed as work. You do not want to list your home address here. As you scroll down, the next question, are you a federally qualified health center? If you're not sure, just Google. And yes or no, it doesn't impact the application. Here, the purpose of the notification, this should be automatically selected that you're a new notification to treat up to 30 patients. That's that level 30. You're going to click that you certify that you're going to use the medication, buprenorphine, to treat patients with opioid use disorder. So you're just going to click that button. And then depending on who you are, you're either going to click that you're a nurse practitioner or physician assistant, or you're going to certify that you're a clinical nurse specialist, CRNA or CNM. So click whatever is appropriate and then continue to scroll down. Now, this is the part with the supervising physician. So the first thing you're going to say, presumably you have your DEA, and that's how you got into here, and that you can prescribe these medications. So you're going to click the button, and then you're going to say, when you prescribe, whether you're required by law to have a qualifying supervising physician or not. And again, this depends. PAs, to my understanding, all require a qualifying physician, whereas nurse practitioners, you need to look it up and it varies by state. If you do say that you need a qualifying physician, then you just need to fill out that physician name, the physician phone number, and again, a work number, not their personal cell phone number, as well as their DEA number. So you do need to have that information to move on with the form. This next part, this is where the confusion comes in. They still haven't updated the actual application to signify that you don't need the training. So we've talked to SAMHSA, and here's what is recommended that you do. The first thing is you certify you've completed the training. Now, I know it's weird because it says the required 24 hours, but it's no longer the required 24 hours. The training is 0 hours, and you all have completed 0 hours of training, if not more. So click that button, and then it's going to ask you, well, where did you get training? SAMHSA's asked that you click the SAMHSA PCSS button. And the next thing it's going to require is to say, well, when did you complete it? What are the dates? And they have said, under the date of completion, write the phrase practice guidelines. So one more time, because this is the important part that's a bit confusing. Certify you've completed the training, and now the training is 0 hours. Click the SAMHSA PCSS button, and then under dates, click practice guidelines. Continuing down, you're going to certify that you have capacity, that you have resources. And for most of us, again, these are resources that we have in our practice, whether we work in the hospital or we work in a primary care clinic. We have access to ancillary services and can refer people as we need to. You need to certify that you understand that with this 30 limit, that you can only have 30 active buprenorphine prescriptions at a time. You can later on, after a year, apply to increase that if you find that you are treating more people. And there are plenty of folks that will increase it up to 100 patients at a time. Scrolling down and finishing the application, you can either decide yes or no that you want SAMHSA to list you under their treatment locator website. Again, remember your primary practice address, they're pulling that from the above. So again, make sure you don't list your home information or home phone numbers, that you list your work numbers. You can also say if you want to be identified as offering long-acting naltrexone, injectable buprenorphine, or implantable buprenorphine. I think for most of these, for us, it's going to be no. But if you have it in your practice and want to list it, then feel free to click yes. And then finally, the last part is the certification. Certify that everything you've said is true to your knowledge, electronically sign the form, and re-enter your DEA number and click submit. And that's it. Once you do that, you should be directed to this page. This is your confirmation. Now, interestingly, you're probably going to see both the green confirmation and the red. SAMHSA is aware of this issue, and this has been something as the practice guidelines have changed and the training requirement changed, but the application form hasn't. Depending on when you do it, you may see it or you may not. Realize that once you've submitted the application, they ask for 45 days to process it. Now, what happens, it's been about 45 days and you haven't heard anything. Couple options. First, you can call the number. Actually, when I've called, they've been very responsive, and you can get to a live person very easily. You can also email info.buprenorphine@samhsa.hhs.gov and ask about the status of your waiver application. Finally, if you find that things have changed in this application, as things are constantly changing, or you have other questions about applying or comments, you can feel free to email me, william.soaresmd@bhs.org. Thank you for listening, everyone. Hopefully this is helpful. Please, 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 it is a quick, free process. Apply for your DEA-X waiver, get it in. And that way, if you find in the future that you want to prescribe buprenorphine for patients with opioid use disorder, you will have the ability to do so. Thanks for listening. Take care, everyone.